We might take it for granted that better pay can lead to better health, but the city of Boston has been especially concerned about people with the lowest pay. That was the reason for the adoption of the living wage ordinance 20 years ago. More recently, there was a closer look at the connection between wages and health done by the Boston Public Health Commission. To tell us about the study is our guest from the commission, the Director of Intergovernmental Relations, Lisa Conley. Thank you very much for being with us, Lisa.
Thanks for having me.
First of all, this is an ordinance that, strictly speaking, only covers 600 people. So why is this so important?
Sure. So it actually covers more than that. It covers around 2,500 people in total. But what we found in our study was that it only covers about 600 people at the low end of the wage scale, which is really what we're interested in affecting with the living wage ordinance. And so the reason it's important is because it's one of the few legal levers that the city has to increase wages among its lowest paid workers in the city. And so we think it's important for that reason.
Well, you want to talk to some of the people at that low end of the spectrum and ask about their health. How did you manage to do that?
Yeah, so it was really an exciting opportunity to do that because we don't often get to do that in public health. So what we did was we partnered with organizations that are working with folks making very low wages, and we got people into a room through community meetings and through a focus group. To have a conversation with low-wage workers about sort of how their health was and what they might use additional dollars to pay for.
Well, one term I was a little surprised to see here was persistent sadness, and I know there was also stress and anxiety,
Sure.
but a lot of people said they felt persistently sad.
Yes. Yeah, a high number. It's actually a correlation between low income and depression, anxiety, persistent sadness, which is not, I think, intuitively a surprise if you think about sort of the challenges that come with being a low-paid worker in the city of Boston and just trying to make ends meet with the costs of living here in Boston. But yes, it's definitely very high rates of persistent sadness.
And there were some hints you got about the children too, about the way they feel, at least the way they were channeling this.
Right. Well, when we spoke to a lot of the parents who were the people we ended up interviewing because they are the low wage workers, they said that often they would go hungry because they wanted to make sure their children had food on the table. And so yes, it definitely affects the entire family.
Again, this is BNN News, and we're talking with Lisa Conley of the Boston Public Health Commission. Lisa, speaking of people going hungry, I look at some of the numbers about people who said they were running out of food or feeling hungry, and some of them are pretty high.
Yes. So we actually, if you did increase the wage, say by $3, which is what we studied in this report, you would find that food insecurity and hunger would both drop by around 30%. So just increasing a wage by $3 an hour, which yields about $6,000 a year in additional funds for the family, would reduce both of those indicators significantly.
Of course, this is also about the quality of food, because if people don't get enough fruits and vegetables and proteins too, I guess there will be some consequences.
Yes, no question. We studied that as well, sort of whether increasing whether increasing the wage would actually increase access to healthier foods like fresh fruits and vegetables.
What about the concern we often hear expressed whenever there's talk of a wage increase that, well, if you give these people more money, there will be just fewer jobs, and then we're just as bad as we were before?
Right. Well, there actually was a study of the living wage ordinance about, I would say, 7 years after it went into effect, and it found that actually there wasn't a reduction in the number of jobs that were offered, that employers just chose to accept less profits. So they still wanted the city contracts, and they ended up paying more, but didn't reduce their workforce.
Of course, you also want to change the living wage because, look, the cost of housing is going up, some other things are going up. So how high does it have to be before we call it a living wage?
Right, so according to the Boston Redevelopment Authority analysis that was done in 2014, it would cost about $16.96 to actually afford all of the basic necessities.
$16.96 an
hour.
Almost $17 an hour.
Yes, and that's for two-parent family or two-person family working. So it's not single parents, it's actually much higher. So that's a two-parent family with 2 children, and working full-time would be $16.96, and that's to afford basics like housing, transportation, childcare, food.
Again, this is BNN News, and we're talking with Lisa Conley of the Boston Public Health Commission. This report also has some recommendations about expanding who's covered and maybe trying to strengthen the enforcement.
Right. So one of the things we found, as you already noted, was that only about 600 low-wage workers are actually covered. And so what we would really like to see is an expansion of the living wage ordinance, because there are a lot of other relationships that the city has contractually, and it could conceivably be inserted into those contracts and expand the population of workers who would experience the improvement of having the living wage coverage.
A lot of people look at low-wage jobs as a stepping stone to something else. A lot of people, of course, they can't get beyond that stone, but does maybe a higher wage help them advance, maybe, or give them hope they can advance?
I think it possibly could. I think the other thing we heard from the employers that we spoke to is they're really interested in working with the city to develop career ladders for these very low-wage employees, so they don't get stuck at the bottom of the wage scale. And I think we've seen that with the Office of Workforce Development working with low-wage employees and really trying to move them out of poverty.
Well, I know there's a lot more detail. You've got the full report on the website.
We do, yes.
For the Boston Public Health Commission. Thank you very much for being with us.
Absolutely. Thanks for having me.
Lisa Conley.